Hello, this is Dr. Anuj Shah, the Director of Apex Heart and Vascular. As 2024 comes to a close and 2025 is about to begin, I'm excited to share the transformative advances in the field of peripheral vascular disease that are reshaping how we diagnose, manage, and treat our patient. This annual roundup is designed to keep our primary care doctors, our podiatry colleagues, as well as anyone who is interested in playing a role in the vascular field. The goal is to keep them informed and ahead of the curve. So let's dive into the studies and innovation that are driving real-world change. One of the most exciting advancements, in my opinion, is the drug-coated balloon and drug-eluting stents. Drug-coated balloons have revolutionized the treatment of femoropopliteal artery disease, one of the most challenging areas and a subset of peripheral arterial disease. There is a very high risk of restenosis and poor long-term patency. A meta-analysis of over 51 trials, including over 8,400 patients, revealed that drug-coated balloons or DCBs improved long-term vessel patency, achieving a success rate of astonishing 74% at 1 year compared to 45% with standard balloon angioplasty. These results reinforce the critical role of drug-eluting technologies in preventing restenosis and maintaining durable outcomes. A second very exciting trial this year was the LIFE BTK trial, which looked at bioabsorbable vascular scaffold in a very challenging patient population of chronic limb-threatening ischemia or CLTI, which is a very devastating condition with up to 25% patients requiring amputation within 1 year if left untreated. The LIFE BTK trial evaluating bioabsorbable vascular scaffold, which was the everolimus device, everolimus illusion, demonstrated an 85% primary patency rate at 6 months and a limb salvage rate of 79%. This represents a significant advancement in managing this very challenging below-knee lesion, offering a new hope for this high-risk patient population. Another very exciting tool that we have is intravascular lithotripsy or IVL, because calcified lesions are some of the biggest challenging. I always say to my fellows that calcification is like our enemy, because with very calcific lesion there is risk of rupture, there is a risk of underexpansion of the stent, so it leads to poor outcomes and suboptimal stent deployment. What IVL has done is it has emerged as a transformative technique in this area. The Disrupt PAD-3 trial, this was a landmark randomized controlled trial evaluating IVL in patients with calcific peripheral arterial disease, and the study demonstrated a procedural success rate of 100% in the IVL group as opposed to 82% in standard angioplasty, with fewer complications and safer overall profile. In addition, the real-world European registry looked at over 540 patients undergoing IVL and reported a technical success rate of 99% and a device success rate of 92%. 1 year follow-up data showed that only 5.5% major adverse cardiac events, highlighting the durability and safety of IVL in routine clinical practice. These findings position IVL as a critical tool now for modifying calcified plaque, enabling precise stent placement, and improving long-term outcomes. This obviously goes with the fourth big thing in peripheral vascular disease, which is our atherectomy devices. We have a number of atherectomy devices, whether it's orbital atherectomy, rotational atherectomy, directional atherectomy, laser, cryo, all those things. Atherectomy total in general continue to advance the field of peripheral arterial disease by offering an effective solution for debulking atherosclerotic plaques, especially in heavily calcific lesions. The EASE trial evaluated the Phoenix atherectomy system in over 128 patients with 149 infrainguinal lesions, achieving a technical success rate of 95%. Moreover, 80% of these patients reported symptomatic improvement with at least one Rutherford class reduction post-procedure. The total reality study combined data sets to compare directional atherectomy plus drug-coated balloon angioplasty against DCB alone, and results showed a significantly lower provisional stent rate and comparable safety outcomes in the directional atherectomy plus DCB group, as of solidifying its role in treating long calcific, what we call the task D calcified femoropopliteal lesion. Atherectomy, particularly when combined with adjunctive therapies like drug-coated balloon, is an indispensable tool in achieving optimal outcomes for complex PAD cases. The VOYAGER PAD trial showed that patients undergoing revascularization remain high at risk for both limb and cardiovascular outcomes. The VOYAGER PAD trial demonstrated that adding low-dose rivaroxaban to standard therapy reduced major adverse events by 15%, marking a significant improvement in outcome for this vulnerable population. One of my favorite trials has been the BASIL-2 trial, which is in severe infrapopliteal disease. The BASIL-2 trial compared bypass surgery to balloon angioplasty, finding no significant difference in the amputation-free survival. This reinforces the importance of tailoring treatment decision based on patient-specific factors rather than assuming a one-size-fits-it-all approach. Switching gear to venous and pulmonary embolism side, the STRIKE pulmonary embolism or STRIKE PE study looked at patients with pulmonary embolism. The STRIKE PE study highlighted the benefit of computer-assisted vacuum thrombectomy, and the results show 31% reduction in right ventricular to left ventricular ratio, RVOT-LVOT ratio, and a 75% increase in patient-reported quality of life within 90 days, underlying its effectiveness in improving both physiological and clinical outcomes. On the DVT side, OncoDVT study looked at cancer-associated thrombosis, which poses a unique challenge, particularly regarding the optimal duration of anticoagulation. The OncoDVT study demonstrated that extending anticoagulation beyond the 3 months provided no additional benefit, simplifying treatment decision in this really high-risk group population. There is a very significant role of AI in vascular imaging. AI has transformed vascular diagnostic, improving accuracy by 23% and reducing analysis time by 30%. These advances enable earlier detection and intervention, ultimately leading to better outcome. This, along with the wearable technologies, is gonna be the real game changer. The continuous monitoring through wearable devices has enhanced patient management. Recent innovation allow for the detection of hemodynamic changes 48 hours before actual symptoms start in over 80% of the patient, enabling timely intervention and reducing complication. And finally, when patients have the most significant disease with very poor healing of the wound, there are a lot of new innovation, especially in the pedal loop reconstruction technique. We now have a new loop graft techniques, which have reduced operative time by 27% and post-operative complication by 15%, contributing to faster recovery and improved patient satisfaction in vascular reconstructions. In conclusion, the past few years have been a period of remarkable progress in peripheral vascular disease management. From innovation in drug delivery systems to the application of AI, our field continues to evolve at an unprecedented pace. As we look ahead to 2025, it is essential that we not only embrace this advancement, but also remain committed to delivering evidence-based and patient-centered care. Thank you for joining me in this journey as we strive to elevate the standard of vascular health.